Safety and first aid. Get set, go. Safety is a very important aspect. We can avoid most of the accidents if we are careful. We should take care of our safety as well as the safety of others around us. For this, we must always be careful and alert at home, school, playground, while boarding the bus or traveling in a car. It is essential to cultivate safety habits. We must follow safety rules to avoid accidents. Safety at school.
Do not push each other and always make a queue for entering or leaving the classroom. Do not stand over the desks or tables. Do not throw things around in the classroom.
Safety at playground.
Never push or hit anyone while playing. Do not fight with one another. Follow the rules of the game while playing.
Safety at swimming pool.
If you are new to swimming, you must not go alone. Go with your parents. Do not swim in deep water. Swim in the shallow water. Never push anybody into the water for fun.
Safety on the road.
Most of the accidents occur on road, so we must be careful while walking or driving on the road. We should strictly follow the safety and traffic rules on the road.
Pedestrians should always walk on the footpath. Cross the road at the zebra crossing. Do not cross the road in a hurry. Do not play or run on the road. Safety from people.
Do not talk or accept gifts from strangers. Do not eat anything given to you by any stranger. A good touch is what you feel when your parents or loved ones touches you. A bad touch is touch or hug given to you by anyone and you don't like it. You should always talk to your parents or your teacher immediately about a bad touch.
Safety from poisoning. Wrong consumption of medicines and accidental consumption of chemicals can cause poisoning and you may fall ill. Medicines and harmful chemicals like mosquito repellents, phenyl, acids, etc. should be properly labeled and kept away from food items. Do not take medicine without consulting a doctor or an adult. First aid.
First aid is the first and foremost treatment given to the victim of accident or injury. Sometimes the injuries are minor. They can be treated at home. A person must have basic knowledge of first aid to treat even minor injuries at home. In some cases, the injuries are deep and the injured person may need a doctor. In such cases, first aid ensures that some basic treatment is meted out to the person till he or she is attended by the doctor. The main aim of providing first aid to the victim are
to provide immediate care and treatment, to make the patient comfortable and relieve his pain, to prevent further damage. First aid can be used on yourself or others. We should always be willing to help others if we can. How to give first aid. Let us learn how first aid can be given for different injuries. Remember that in any emergency, the first step is to call for help. You can call your parents, teachers, or family doctor for assistance. Never panic. Remain calm and make the injured person also calm. First aid for cuts, abrasions, and wounds. In case of any cut or wound, the aim of giving first aid is to stop the bleeding. Following things must be done in such cases. Clean the wound properly with water. Apply pressure on the wound to stop bleeding. However, if it does not stop, one must consult a doctor or take patient to the nearby hospital. Apply antiseptic cream available in the first aid box. Apply a tight bandage. If the wound or cut has been caused by any dirty or rusted object like rod, nail, wire, etc., then it is important to get anti-tetanus vaccine from the doctor. First aid for a bleeding nose. Bleeding nose is common during hot summer days. The nose contains a dense network of blood vessels.
These blood vessels can sometimes get ruptured due to hot and dry air. Of course, there are other reasons for nose bleeding too. In case of bleeding from the nose, following things should be done. Ask the person to lean little bit forward. Put a wet towel on the patient's head. Press the place for a few minutes. Let him breathe through his mouth. If the bleeding does not stop, take him to the doctor or hospital.
First aid for burns. Burns can be caused by boiling water, fire, hot vessels, oil, or even electricity. Burns may be minor or major. Let us see how it can be handled. For minor burns, remove the burnt clothes if sticking to wound. Gently remove the things in the vicinity of the wound like a ring, watch, shoes, etc. Pour plenty of water on the area. Pat gently with a soft cloth and apply aloe vera gel. Once the victim is comfortable, apply antiseptic cream and cover lightly with a bandage. For major burns, gently remove the things in the vicinity of the wound. Put the burnt area under the water. Cover lightly with a bandage to see a doctor. First aid for animal bite or sting. Animal bites, scratches, or even animal stings can sometimes get complicated if not attended well. Even if it is a pet animal, bites or scratches can cause infection. In case of bites or sting, do the following first aid. Wash the wound with soap and water. Apply antiseptic cream. Apply a light bandage. If it is an animal bite or scratch, then one must consult the doctor for the anti-rabies vaccine. Fascinating fact: sometimes due to burn, blister may also form. First aid for sprain.
If you sprain your foot, you may have pain and swelling accompanied by it. Do the following in case of sprain. Do not move the injured part. Apply an ice pack to the sprained part. Apply sling or bandage to immobilize the part. Consult the doctor.
First aid for fracture.
Breaking or cracking of a bone in our body is called a fracture. It is accompanied by severe pain. The victim may not be able to move that part of the body. In such cases, do the following. Do not move the injured part at all. Apply a splint and bandage so that the movement of the part is restricted. The person must be taken to an orthopedic doctor immediately. An orthopedic doctor looks after bone injuries.
Safety sign. Safety signs are pictures or symbols which warns us about dangers.
Stop, no pedestrians, no bicycles, road work ahead, signal ahead, left turn ahead, yield, railroad crossing, school ahead, do not enter, hospital, speed advisory.
Let's sum up. It is essential to cultivate safety habits.
First aid is the first and foremost treatment given to the victim of accident or injury. A person must have basic knowledge of first aid to treat even minor injuries at home. The first step is to call for help. Never panic. If the wound or cut has been caused by any dirty or rusted object, then it is important to get tetanus vaccine from the doctor. Bleeding nose is common during hot summer days. In case of fire, remember the 3 golden words: stop, drop, and roll. We must use a fire extinguisher, put out a fire. Rabies is a disease which usually spreads by the bite or scratch of an animal.
Breaking or cracking of a bone in our body is called a fracture. The person must be taken to an orthopedic doctor immediately.